Hello. So this presentation was done by Peter, Morgan, Sierra, Corey, and Abby. Our presentation is about how a morphine error led to a patient's death in a Northwest Minnesota nursing home. The patient had a severe cognitive disability, and he was given 10 times the prescribed dose of morphine. The resident died an hour and 45 minutes after the medication was administered. The Minnesota Department of Health reported that the facility failed to have an adequate policy in place to ensure medications were transcribed accurately and then administered correctly. So the patient had chronic kidney disease and he was suffering from that. And then the ordered morphine sulfate was supposed to be given in an oral syringe every hour. And the order was transcribed wrong onto the patient's chart, and the patient received 10 times the dose that he was ordered. It didn't have the dose in the article. So the error was discovered 15 minutes after it was given. The patient was given Narcan, but the patient's breathing had decreased to 2 breaths per minute when they were going to give the second dose of Narcan. The patient had already passed away before the nurses and staff could administer that Narcan. So some information about morphine that we can see in our patient here is that morphine causes severe respiratory depression, which is why it's so important before we give morphine to check the respiration rate. And as we know, morphine is an opioid analgesic, and it is a Schedule II drug, and it is used to treat pain.
How did the medication error affect the patient? In this medication error, the patient was given 10 times the prescribed dose of morphine. The patient was administered an initial dose of Narcan, and their breathing had diminished to 2 breaths per minute. The patient died 1 hour and 45 minutes after the medication error occurred.
So how did the family respond to this mid-error? So as soon as the employees at the facility notified the family of what happened, they requested a dose of Narcan to be given to him. And his respirations were at 2 breaths per minute. And at this point, the family requested that a second dose of Narcan to be given. He was transferred to a hospice care facility the day before this happened, so the staff had to go to the hospital to get the Narcan and come back. Unfortunately, the patient had already died before the staff members made it to the nursing home from the hospital. The article does not state what they thought or what they said once he died, but you would imagine that they were most likely frustrated, considering it was too late by the time the staff returned with the medication that had the potential to save him.
In this article, it didn't state how the nurse was affected or charged with anything, but if there were charges of malpractice or patient neglect, it would consist of a written warning, like being written up, loss of privileges, maybe not being able to give medications, suspension, maybe a couple days suspension, not being able to come back to work, or even termination, being fired. They could have also lost their license. This nurse could have received leniency, considering that she did attempt to advocate for the patient, even though it wasn't effective. Or the nurse could have received one or multiple forms of these disciplinary actions.
So the first core concept that led to this medication error is the incorrect transcription of the drug to the patient's record. The nursing home was held responsible for failing to transcribe the patient's medications accurately. The article stated, the facility failed to have adequate policies in place to ensure medications were transcribed accurately and then administered correctly. The patient asked the staff once before if the dosage was correct, and he was told that it was correct. This would have been the perfect time to call the provider and verify the dosage, but the nurse neglected this action. The errors that are transcribed incorrectly are harder to prevent due to the fact that a nurse may assume the dosage is transcribed or documented correctly. This is where the 6 rights of medication administration come into play. The nurse had the right patient, the right medication, the right route, and the right time, but due to the incorrect transcription of the drug, it resulted in the wrong dosage. In this case, the dose was 10 times more than his prescribed dose called for, which unfortunately resulted in the patient's death.
So the second core concept that led to this med error was that the nurse didn't effectively advocate for the patient and clarify that the medication was safe to give. The medication was 10 times the amount that was intended to give to the patient. Even though the nurse did question the medication, she still administered it. She still administered the drug instead of seeking more approval from a higher nurse. The patient could have lived longer regarding other comorbidities if this medication was questioned more. The nurse is supposed to be the one that speaks for the patient, even if there is any chance of neglect or harm present. Even if the nurse was cleared to give the medication and there was still doubt for the nurse if the medication was safe, the nurse should have spoke with someone higher up, maybe even the doctor, to ensure that the medication wasn't toxic or lethal.
Core concept number 3 that led to medication error. The nurse did not verify the order with the physician. Neither the transcribing nurse nor the administering nurse tried to clarify the order with the physician. A dose that is 10 times over what is supposed to be given should have been in question. However, one of the other nurses tried to question the order, but nothing was done about it. Had either of the nurses clarified the order with the physician, the medication error could have been prevented. If the order was taken over the phone by the transcribing nurse, she should have verified the order with the physician before hanging up.
We will use this in future practice by adhering to the rights of administration. When administering any medication, right drug, right dose, right patient, right route, right time, right reason, right documentation, right patient education, right evaluation, and the right to refuse the medication. As pointed out all throughout the presentation, that the med error that occurred is a dosing error. In future practice, we will ask questions even when something looks off, like the nurse didn't do. The nurse that administered the medication, she just administered it without second guessing or like double checking. And she should have used her critical thinking to notice that something was off with the dosing. And so as we know that like that is asking questions, it has been like heavily taught to us throughout the semester, and it is also ultimately the nurse's fault if an error happens and she administers the medication and something happens to the patient, that falls on the nurse due to the nurse actually administering the medication. Due to morphine having the high risk and adverse effect of respiratory depression, it is so important to monitor patients for respiratory depression. So it's important to check the respiration rates and monitor them throughout therapy and before therapy and after therapy. So we will monitor our patients for adverse effects in the future. It is also important for the nurse to limit her distractions when administering meds, because something can go wrong and the nurse needs to give all of her thought onto administering medications in that specific patient, all of her attention. And finally, if we do not know a drug or the normal dosage range, we will look it up. It is important for the nurse to know the medication and what it does and information about it, and it is important for the nurse to know the normal dosage range so that way she will know whether or not the dose is safe for the patient, and the right drug and right dose are both rights of administration, and so therefore it's very important for us to adhere to that. And so, yeah, I hope you guys enjoyed hearing about how we will use this in our future practice.
So, how is this relevant? Similar to the Northwest Minnesota nursing home case, medication errors occur countlessly. This is important to nurses in nursing practice because as nurses, one of our main roles is to mitigate and reduce the risk of medication errors. In practice, errors can occur at the different stages or levels of medication administration. For example, in the prescribing stage, there are tons of errors that can occur, like which medication should be administered, what dose should that medication be administered, what route, and what frequency. And so, though this does not pertain to the scope of practice of a nurse, it does pertain to how that nurse will administer that medication. And so, as nurses, it is our role to verify orders, especially if we find any discrepancies. And so, we have to make sure that we are verifying if we do find a discrepancy with either the provider or prescriber, the pharmacy, and or another nurse that can verify the correct dosage. Another error-prone example that we may see in practice are look-alike, sound-alike drugs. And this oftentimes leads to substitution errors, where one medication is substituted for another. And an example of that would be hydromorphone and morphine. And though these drugs are very different, they do sound alike. Hydromorphone, for example, has a higher potency than morphine. Hydromorphone is 5 to 7 times more potent than morphine. And so one of the benefits that we have to avoiding this error in practice is the usage of the barcode scanning at the bedside. Other ways of preventing medication errors are system-based approaches. And so what I mean by that are automatic warning signs that tell you whether you are administering a safe dose, the implementation of standard volume charts, and also protocols for opioid agonists if you do encounter an overdose. And that includes protocols such as for Narcan. And so, according to a study by Amanda Lowe entitled Fatal Overdoses Involving Hydromorphone and Morphine Among Inpatients, a case series, the study found that the use of system-based approaches such as electronic prescribing, predefined intervention parameters, smart infusion pumps with embedded drug libraries, and barcode verification at the bedside all aid in the prevention of fatalities. And so there are also practical ways that nurses can reduce medication errors. And so some of the practical ways that nurses can mitigate errors in practice are by simply reviewing your 5 rights of medication. And that includes making sure that you have the right patient, the right drug, the right dose, the right route, and are administering it at the right time. And I know that we've talked about this throughout the entire semester, and it's very important under our scope of practice as nurses, and also to mitigate those medication errors. Another practical way that nurses can reduce medication errors are simply by referring to a drug book if you don't know what a certain medication does or if there's a contraindication. And I know that there are also embedded reference books in some of our systems in the hospital. And lastly, calling the pharmacy to verify a medication or verify a dose, a route, is probably one of your best bets in reducing your chances of a medication error. So in conclusion, there is good news and bad news. The bad news. We are all human and are prone to making mistakes, even fatal ones. As a new nurse, this can be intimidating and discouraging. Opioids have a narrow therapeutic window and errors can be fatal. However, there is good news. Opioid-related deaths can be avoided and prevented. Deaths related to morphine can be avoided at the individual stages of prescribing, processing, dispensing, and administration by remembering the 5 rights of medication administration. It is important to recognize and report when a medication error has occurred. As a nurse, we also possess the power to influence change, policy and practice, design strategies, conduct research studies, evidence-based interventions to prevent these fatalities. And it is why it is reassuring to us as nurses that we have the ability to prevent and reduce medication errors.